Good morning, everyone. Paresthesias here, Doctor of Physical Therapy. I wanted to hop on and talk to you guys about a new topic in regards to chronic pain. And if you haven't already seen, I made a few videos in the past few weeks about chronic headaches and migraines and what symptoms you might have and what can cause someone to have chronic headaches and migraines. So if you haven't check those videos out, feel free to check them out on my Instagram or my YouTube channel, Paresthesias DPT, and also on my Facebook group, Chronic Pain Management for Patients and Providers. There should be some video links there. And yeah, the new topic for this week that I wanted to kind of talk about and introduce is fibromyalgia. Fibromyalgia is a term that I think is thrown around a little loosely sometimes, and without a formal diagnosis, it's really tough to say if someone has actual fibromyalgia, but nonetheless, it's a common diagnosis in terms of chronic pain. And so what is fibromyalgia? Fibromyalgia is a disorder that can cause diffuse, widespread pain in a person's body. So fibromyalgia typically affects women more than men. There's usually a psychological component to it as well. Concurrently, fibromyalgia seems to be diagnosed in individuals who also suffer from depression, anxiety, PTSD. It usually occurs after some type of physical trauma, a surgery, or a very significant psychological event. It affects women more than men, and I don't know, what the main factors are for that, but I wouldn't doubt that hormones and certain psychosocial factors can play a role in someone developing fibromyalgia. With fibromyalgia, the symptoms can vary from individual to individual. Most people complain of diffuse widespread pain in certain areas of the back, in multiple joint areas, in multiple spots in a person's posterior region, so the back all the way down to the feet. They also experience a lot of fatigue. So someone with fibro will also not only have pain, but a lot of chronic fatigue, general malaise, mood disorders, difficulty sleeping, and the pain can be described usually as very, very achy, sore, sharp. Also in the extremities, people tend to have temperature changes within their hands, so their hands can get very, very cold. And the ones that I've seen in my line of work usually are women, and they usually do have certain tender points that can lead to a diagnosis of fibromyalgia. Now, these tender points are usually 2 points that are opposite of each other in a person's back or shoulder region, but you can pretty much push on these points and the person will note increased tenderness. And so with these points, there's a certain amount that a person can get, which can lead to a diagnosis of fibromyalgia. I don't have that certain number on me right now, but I'll be sure to give you guys that number. But it's a diagnosis that affects a lot of people and affects quality of life. So a lot of these patients experience difficulty sleeping, widespread pain, fatigue, mood disorders. They may even have like brain fog. They come in and they look like they're kind of like in a daze. That can indicate fibromyalgia diagnosis, but then again, of course, like a medical doctor is the one that needs to formally diagnose an individual with fibromyalgia. So that's kind of like a little intro into fibromyalgia. Some of the symptoms can vary person to person. Usually there's tender points that can be identified within a person's body that can lead to this diagnosis of fibromyalgia. But it is something real, and it is something that affects a lot of people suffering from chronic pain. There are things that can be done to improve the symptoms, but I don't, at least in my experience, have never seen someone actually 100% recover from fibromyalgia. It's more so a management diagnosis rather than a diagnosis that someone can actually fix and get rid of. But it is very manageable, and there are patients who have it who still live fulfilling lives that they know how to manage it, and they know what their triggers are, and they know what makes it feel better, and they know what makes it feel worse. So that's what I'm hoping to teach you guys with my upcoming course. So just so you guys know, this is one of the other diagnoses that will be in the course. If you are interested in getting on the pre-sale list, sign up via my SendFox link, which is down below. You can also shoot me a message personally, and I'll be happy to get you on that list. It is a work in progress, but I just wanted to let you guys know that fibromyalgia is another topic that will be covered, as well as how to treat it and what to do if you are a provider. So I just wanted to wish you guys a good day, and I will talk to you guys soon. All right, bye.